In the developing world, if a mother dies, she will leave behind children that will most likely be sentenced to a life of poverty. For over 40 years, Jopaigo has been empowering local communities to prevent the needless deaths of hundreds of thousands of mothers throughout the world.
One morning I report on duty. I find this mother was having bleeding after delivery. Before she passed out, she said, "Sister, usiruhusu nife, don't allow me to die." There was this small lobe remaining. So I removed it manually. We had been taught that. We had been told we can do that as midwives. So I removed the membrane. The uterus contracted. The patient stopped bleeding. When she woke up, she asked me, "Sister, nilikuwa wapi? Where was I?" So I asked her, "Where were you before?" She told, "No, I thought I was dead." I told her, "No, in Tigoni we don't believe in maternal death. We believe in you going home."
Jopaigo supports 1,149 medical facilities in Kenya alone.
National HIV transmission from mother to child, at 18 months, we are still at 9%.
Yes.
But in this facility, they're telling you it is 0%. There's no transmission of HIV from mother to child anymore.
Women in slums often have as many as 6 or 7 children. Without family planning, a couple can easily get stuck in a cycle of poverty.
I had a mindset that I need 5 to 6 children. So life was not easy. It was not easy. Things were difficult. I could not be able to give my family balanced diet. That time I became dragged because I don't want to see the what's happening.
Hapana, yeye sikuwa najua story ya family planning. Nikapatana na community health worker. Akaniongelesha, akaniuliza kama anajua about family planning. Nikaingia box, nikamsikiza. Hata bwanangu akashangaa, mbona nablidi sana kama nimetoa mimba ingine. Akamwambia ubaya na uzuri. Lakini yeye bado akona ile nini sasa kusema nikitumia hiyo family planning nitakuwa mbaya. Haya. Akamuuliza sasa vile ako hivi ni mbaridi. Akaambia kwa sawa tuko kwa gari ya tatu. Akaambia nigize kwa mkono. Akapata iko nayo.
I'm born within the urban slums. Growing up, we were 7 children living in this with my mother and father. But really the person who had the burden of the family was my mother. So she took care of all the 7 of us. But because of the challenges in the informal settlements, many of my sisters and brothers did not continue with school. I lost my brother to HIV and AIDS. I lost my sister to HIV and AIDS. So all those things really affect homes. But I went to school. I was able to go to my primary school, secondary school, university, master's degree. And so I really understand the issues in the informal settlements because I am really one of them. At Jopaigo, we are so much into maternal reproductive health, issues of family planning, HIV and AIDS, malaria, a lot of very cervical cancer. These are very technical health areas. But then I have to bring in the aspect of the social determinants of health. We educated community health workers to encourage the women to have safe deliveries in the health facilities. It's very insecure. The young men will terrorize us. We can never get into the health facility at night. So we had a way of reaching the young men, the ones who were terrorizing these women, and equip them with skills.
I was giving my mother pressure because my mom needed to feed me, feed my younger 2 sisters and my older brother. So I decided to join the street and live a street life. At that age, I was at 7.
7 years old.
Yeah, 7 years old. So when I was using drugs, inhalants, glues, you feel like you are invisible. Then you can rob. But I was rescued by another organization, and we started working with CHWs and the youth together in escorting women and children. But one day when I went, I found the woman that I'm escorting. Once upon a time, I did something wrong too. But now, the woman really understands me, and I escorted the lady. And if it is not for this program, I don't know where youth could be. I don't know myself where I could be now.
So these young men, from criminals, they've actually become like the saviors. So that's very moving stories, and it keeps me alive. It keeps me awake at night and looking forward to what I'm going to do with them the next day.
I feel good. I feel good. I feel I saved a life, and that is my basic responsibility as a midwife.
The happiest thing now, we are free from stress.
Japego really means a lot to us as a community, because it's one of us, our family, brother and sister, and our mother too, because they give us a support that we don't get from anyone else.
The story of Japaigo is the story of change. By placing resources and skills into the hands of the people, you can change the health of a mother, the future of her children, her community, and the world.